Sat Sri Akal and hello everybody. My name is Dr. Rooprai. I'm a medical doctor and a surgeon in training based here in Nairobi, Kenya.
Sat Sri Akal and good afternoon. My name is Onkar Bhogal. I'm a medical doctor specializing in infectious diseases, also based in Nairobi.
So for the purposes of this talk, we are just going to bring our masks down for the clarity of the voice, but we have taken the necessary steps to avoid transmission of COVID-19. So today we are here to talk about COVID-19. So Dr. Bhogal, what is COVID-19?
Okay, thank you. I'm going to try and keep this as simple as possible and as basic as possible. Towards the end of this talk, hopefully, if any of you have any queries, you can just put them in the comments and we'll try and address them as we get along. So COVID-19 is just a respiratory virus, like a lot of other respiratory viruses we've had for a long time in history. The only difference is that this is now a novel virus, which means it's new. We don't really know much about it. It's spread just like any other flu virus. It behaves just like any other flu virus. The only difference is that the mortality that we are seeing now with COVID is a lot higher than what we do get with other flu viruses. And that's why it's of so much interest to us.
Okay. And well, COVID-19 is a pandemic, but what's our local situation?
So locally, if you look at the global picture, we're doing quite well. I think the highest number of cases we've had in 24 hours is just about 500. If you compare this to what's happening in the West, in America, in England, in other countries, certainly the amount of cases that we are seeing locally have been increasing with time. We initially started off with 20 cases a day, it went to 50 cases a day. We're now up to almost 500 cases a day. Okay, so the situation is getting worse and worse as time goes along.
Okay, just to recap on the transmission of COVID-19. So how can you get infected?
Like I said initially, it's just like any other flu. And if I can just make it very simple for you to understand, the only way you're going to get COVID is either through your nose, your mouth, or your eyes. There is no other route of transmission. So if you can protect your nose and your mouth with a mask and try and avoid touching your eyes, most likely you'll not get it. And this is where face masks and social distancing and hand washing comes in.
Okay, fantastic. So there we go. So we know how to prevent from getting it. So who are the vulnerable populations?
So let's make a distinction here between vulnerable population and who can get it. Yes, everybody can get it, regardless of your age, regardless of your sex, regardless of your health. Everybody is vulnerable to get COVID-19. The good thing is that up to 85% of people who do get it, it doesn't cause any harm. It causes almost no to very mild symptoms. Maybe a bit of a runny nose, a bit of a sore throat, maybe some fever, but something that burns out, just like any other flu. So everybody can get it. But there's a certain part of the population that is now vulnerable to getting the severe form of the disease.
Yes.
And these are the people who are elderly, the people who have other conditions before they get the COVID. Either they're diabetic or they're hypertensive, or they have some respiratory illness, they've had heart attacks, they have autoimmune illnesses, or something that pushes them closer towards the edge, and then COVID pushes them over.
Okay. So now if you're suspecting that you are infected with a flu-like illness, or you are suspecting that you have been in contact with a patient who has been diagnosed with COVID-19, so what should you do next?
Okay, so there's two parts to this question. If you do suspect that you have been infected by COVID, it's very difficult for a patient to distinguish between what we call the common flu or the influenza and COVID-19. So if at all you do display any symptoms, and the issue really is that there's so much of an overlap between a common flu symptoms and COVID symptoms. They'll both give you a runny nose, they'll both give you a bit of a sore throat, they might give you a fever, they might give you a cough as well. So really to distinguish between the two, you really need to go see a doctor and try and get him to figure out whether this is COVID or not. Okay? Once you do suspect, be it the flu or COVID, whichever one it is, you must be very conscious of the fact that you have now become infectious. So if you're symptomatic, not only are you at danger yourself, but you're also at danger of spreading it to other people. other people who could be in the vulnerable population we've discussed. So, number one, isolate yourself. Okay? Wear a face mask, socially distance yourself completely, go get a COVID test done. It's very important for you to do this COVID test. If it comes back positive, then we know that for the next 2 weeks, you must stay away from everybody so that you don't spread it to other people. If your COVID test comes back negative, you still have to take the usual precautions we do take when we have a flu. So that's how you go about it.
Yes. So let's say you've been diagnosed with COVID-19. You've tested positive for COVID-19. So what should you do next then?
Okay, now this is where you can split it into 3 groups. Okay? About 85% of the people who do get diagnosed with COVID, it does nothing to them. Like I said, it's a very mildly symptomatic illness. So all you have to do is isolate yourself, eat healthy, drink healthy, get some exercise, try not to come into contact with anybody. Be very conscious of the fact that you are now infectious. So you may not have any symptoms, but you can still spread it to other people. And that's about 85% of our population. Another 10% will be mildly symptomatic. They may have worsening fevers, worsening shortness of breath, worsening cough. For these people, it's a good idea to go see your doctor. Okay, we want to make sure that it remains mild and does not progress to become a severe illness. 1 to 2% of our population will require admission into hospital, critical care with intubations and ICU management. So depending on which category you fall in, if you fall in the first category, isolate, eat healthy, drink healthy, and stay safe. If you're in the second category, go see your doctor. Let him make sure that you remain as a mild case. And of course, the third case, you go straight to hospital and then let the hospital team take over.
Okay, fantastic. So what are the common myths that you encounter on a day-to-day basis regarding COVID-19 infection?
Many myths. Of course, the first myth is that there's nothing like COVID. It's all about 5G network and things like that. So I think I'll speak for the whole scientific community to reassure everybody that yes, there is a viral infection called COVID-19. It is here, it is spreading, it is real, it is true. So don't be under any false assumptions that no, this is some propaganda and this is all an economical, way to make money, etc. No, it is here and it is real. Okay. As far as allopathic or mainstream medicine is concerned, we really don't have a treatment for COVID. Just like we don't have a treatment for so many other viral infections that are going around. Take HIV, take hepatitis, take herpes, take polio, take rabies. We can't treat them. This is just another viral infection that we're really struggling to treat. So as far as the azithromycins and hydroxychloroquines and all these things, they have not been proved to at all treat COVID. So if you allow the virus to run its course, it will burn out. Except in that very small population that need critical care, it will burn out. From haldi wala pani to steam inhalations to all these things, they are all symptomatic management. So if you have a bit of a sore throat, if you gargle, it'll get better. If you have a bit of a blocked nose and you steam, it'll get better. But the virus per se, no, you cannot harm it with these things.
Okay, all right. So what does the future hold now? Apart from the fact that, like you mentioned, that it's eventually going to burn out on its own and probably stay and be in either a mild form with occasional severe cases here and there.
Future is difficult to predict, obviously. I mean, the virus it's such an evolving illness. Every week we have a different scenario. But if you just look at the long picture, I think our get out of jail card is probably a vaccine. If we somehow manage to get a vaccine, then definitely we can see the end of COVID-19. Looking more and more likely, but vaccines are always very difficult to predict whether they'll work or not. If we can somehow get an antiviral medication that treats the COVID effectively, which we still don't have yet, that could be another get out of jail card. So we may not prevent you from getting COVID, but if you do, it's treatable. And so then it becomes less scary, and less of a problem. I think if one of these two things works out, or a bit of each, maybe you get a vaccine that gives you 50% protection and a medication that treats you more or less 50%, then we're looking at much brighter future. if none of these two come through, then I think we're going to have to get used to the new normal, the face mask, the social distancing,
Yes.
and hope that as the virus progresses in its own natural evolution, it mutates and becomes less pathogenic and hopefully become just like any other flu virus that's going around.
Okay, fantastic. We're now open to questions. Okay. What we can advise to do is that that wraps up for now. We can have a question and answer session in the future, which you will be told beforehand. All right? Thank you, everybody. Keep safe and stay healthy.
Thank you very much for this opportunity to come and talk to you guys. Keep safe, be healthy, and if you have any questions or queries, please post them in the comments, and in our next session, we'll try and address them. Thank you.
Thanks.
Hey,